Good morning, Kiev. Good morning, Ukraine. I can see it's again beautiful weather over there, while here in the Netherlands it is raining cats and dog. It's like winter here. This morning, I hope, we have a very spectacular session, a session on interventions that really matter, and on why is it so difficult to decide which efforts should we undertake to really improve outcome. Today I will start with RH disease, with cerebral palsy, with asphyxia, with whatever it is, alcohol. Then Professor Alfirovic from Liverpool in the United Kingdom will continue on cervical length measurements. Should that be implemented universally in all countries? And finally, Professor Nicolaides from London, United Kingdom, will discuss early preeclampsia and the implementation in nationwide screening. I will now try to share my screen. Host disabled participation. I will do it again. Host is there we are on air now. Very good. Implementation of intervention that really matter. Presentation from RH disease prevention to fetal monitoring, prevention of preeclampsia, cervical length screening, to finally alcohol abuse in pregnancy. Where should our priorities be? Well, for the doctors, usually it is new toys. And if you look at healthcare officials, factors influencing general health of the population, food abuses, weight prevention. If you look at the doctors, what do we like? New technology, toys for the boys, cervical length measurement. We love to show people that we can measure cervical length even without proper training. But it's nice, it's new toys. We measure Dopplers. Yesterday we learned that in RH negative women, we rather do a Doppler of the middle cerebral artery than to give medication, to give anti-D immunoglobulin during pregnancy to prevent the disease. And forgetting the disease, we love to treat with laser therapy in case of twin gestation, or give intrauterine blood transfusion. And if you look at the different countries, there are too many centers, usually in all these countries, because doctors love it. It's also rather complicated to screen for early preeclampsia and to treat the right women with aspirin. We rather give Viagra to early fetal growth restrictions, then we can show that we're up to date. We treat our patient with the most modern treatment, even without there being any evidence that it helps. And by now we know that Viagra indeed doesn't help at all. But it's amazing to see, before there were any randomized controlled trials, how many doctors worldwide were already giving Viagra to pregnant women with a severe early fetal growth restriction. Let's move to the healthcare officials. Yesterday that was discussed by Victor, and I think the title of his presentation was Crime and Punishment. Not very constructive if we see what healthcare officials are generally doing. But on average, there are not many contacts between these groups, the doctors and the healthcare and the government officials. And also these healthcare officials generally are not very active, apart from campaigns against smoking, which, by the way, of course, is very good. But what about prevention overweight in children? Not really serious intervention, and these are epidemics that are terrible throughout the world. If you go to the largest hospital in Bangkok, in Thailand, you will find a McDonald's within the pediatric department. And if you go to Nairobi in Kenya, you'll find advertisements of Coca-Cola on top of the children's hospital. No, we're not yet serious, and there's not enough contact between the doctors and the healthcare professionals. If we come back to intervention that really matter, this slide I've shown yesterday, the current burden of Rh disease is about 120 perinatal deaths and 40,000 cases of current icterus and cerebral palsy, 40,000. With about 130 million births per year, that means an incidence of 0.3 per 1,000 births. Well, this is cerebral palsy overall in Sweden from 1950 till now in 2010. And you can see that the overall incidence has not decreased over the years. It's about, in total, about 2 per 1,000. 2 per 1,000. And if you look at the literature, about 15% is supposed to be due to birth asphyxia. In other words, 0.3 per 1,000. So cerebral palsy due to birth asphyxia has a similar incidence as that due to Rh disease. And which one do you think will be easier to prevent? All the cases of birth asphyxia or all the cases due to Rh disease? Well, in the 50 years of fetal heart rate monitoring during labor, we have up till now never been able to show that it improves, that it really improves perinatal outcome. Well, up till now, because the last couple of years, finally, there seems to be some progress. Data from Portugal on refined fetal monitoring, accompanied by training, you can see a striking reduction, more than twice as low, within 10 years of hypoxic-ischemic encephalopathy. Similar data from my institute in Utrecht in the Netherlands, you can see there is a striking, a 5-fold reduction in birth asphyxia occurring over these last 15 years, and that all happened during a randomized controlled trial on the new technology, the stent technology. At the end, we found that this technology itself doesn't help a lot. But all the training and the motivation of the doctors during a randomized trial that happened during that time period was most likely the reason of this striking reduction in acidosis at birth, and also an almost 50% reduction in severe to moderate neonatal encephalopathy. Yes, we can, and we can do much better, apparently, than we usually do. And it's not the modern technology, but it is the motivation, it is the training. And there are similar data from London, from Finland, from Norway. Apologies. Also from the randomized controlled trial on intrapartum fetal monitoring in the United Kingdom, the infant trial, including altogether 46,000 women. No difference between intervention group and non-intervention group. But if you look at this, only 3 stillbirths in 46,000 deliveries and moderate to severe encephalopathy in an incidence of below 1 per 1,000. So here are motivated doctors. They're participating in the trial. There's no difference between the two arms of the trial, but they do extremely well. Yes, and that is one of the problems that we have. We can do so much better than we usually do, but usually, no. We don't have the intention, we don't have the, we forget to do it, and forget about all these machines have no brain, so we have to use our own brain. So coming back, which one is easier to prevent? Cerebral palsy due to birth asphyxia to RH disease? Well, RH sensitization can be prevented in 99.7% of cases. So why is or has our focus been so wrong? This is a slide I copied from Viktor Osovsky's presentation of yesterday. 10 steps to improve the situation in Ukraine, and in many countries it may be like that. Yes, we need to have the right priorities, refer the patient, don't terminate pregnancies because of RH sensitization, but treat these women. Involve medical health care bloggers, in other words, inform patients. And doctors should have the right priorities, not measure the middle cerebral artery, but give anti-globulin during labor. And also, we should involve government and medical health care officials, because we cannot do it all alone. No, we have to work together. Moving to another topic, the topic of fetal alcohol syndrome. And here you can see the worldwide situation. The incidence is 8 per 1,000. So now we're talking about a much higher incidence. And if we look a little bit more closely at Ukraine, here you are, there you are, the incidence of really developed, fully developed fetal alcohol syndrome is more than 20 per 1,000. More than 20 per 1,000, which is 2%. If you compare that to cerebral palsy due to birth asphyxia, 0.3 per 1,000, or due to RH disease, 0.3 per 1,000. Well, I'm very optimistic, and I will guess that you will prevent the latter, cerebral palsy due to RH disease. This one is going to be difficult and will cost a lot of effort. But look at this. Fetal alcohol disorders really developed syndrome 20 per 1,000. This is how the Germans were thinking about the beautiful Dutch girls, alcohol, drugs, and whatever it is. And this was on the front page of a German paper. Fortunately, from here, the slide to the left side, you can see that the Dutch are drinking less than the Germans. But still, it is a major problem. And alcohol and pregnancy, there is a clear dose-response relationship. Of more than 1 glass alcohol per day during pregnancy, there will already be hyperactivity in the newborns. With 1 to 2 glasses, there will be a low ABGA score and a reduced head circumference. With 2 glasses, birth weight will be lower, and the IQ has already been decreased with 6 points. From 3 glasses onwards, congenital malformations. From 5 glasses onwards, severe central nervous system malformations and disturbed behavior. And from 6 glasses onwards, you may find fetal alcohol syndrome, although susceptibility of the individual woman may differ a lot due to different rates of metabolization. Altogether, if you take all the alcohol-related problems together, worldwide, it's about 2 to 5% of all newborns, and real fetal alcohol syndrome is about 8 per 1,000. What about women drinking less than 1 alcohol per day? Well, usually it may not affect that much, but if these women may have a slow metabolization, and there are 4 genes involved in slow metabolization, it has been shown that IQ at the age of 8 years old is 2 points lower per gene involved. So if women would have these 4 genes involved in slow metabolization, there might already be a decrease in IQ of 8 points. And fetal alcohol syndrome, facial dysmorphology, growth restriction, also more preterm birth, neurodevelopmental abnormalities. And there is a wide scale of abnormalities, cognitive problems, executive dysfunctions, and behavioral problems. And with the fetal alcohol syndrome, what about the IQ? Well, you can see overall it falls from about 110 to about 75. So a striking reduction in alcohol use during pregnancy at a lower rate. On this publication, you can already see also an enormous effect on the IQ. How do we prevent? Well, warnings from the healthcare professionals effectively don't help. Even government warning on the labels of bottles, it has made no difference. No, there has to be a selective intervention to these women. And reducing drinking can improve outcome. First trimester drinking, only a 12-fold increase in abnormalities that are found with fetal alcohol syndrome. But if the women drink also during the second and the third trimester, you can see there is a 65-fold increase in these kind of abnormalities. Compared with all trimesters, the risk of fetal alcohol syndrome may decrease if drinking is only restricted to the first trimester. Then there is a 5-fold lower incidence, 12 as compared to 60%, which indicate that cutting down alcohol abuse during pregnancy largely affects outcome. There is good evidence that formal screening and brief intervention via motivational interviewing is effective in getting women to stop or cut down the drinking during pregnancy. So this is extremely important. And obstetricians can contribute to reducing the frequency and severity of fetal alcohol syndrome via formal screening and brief intervention. We can do it and should do it. It's not very sexy to do it. During the first consultation, to discuss these aspects, to bring them under the attention of these women. But these are really interventions that do help. And of course, doctors cannot do it alone. We should involve government and medical health care officials, government campaigns together with doctors who really take this seriously in early pregnancy, because a lot may be gained by doing so. And what about the next presentation, the routine cervical length measurement? It has not been implemented nationwide in any country, at least that's what Professor Alfieri said half a year ago. Is that a pity, or is it in a way too difficult for us? And what about early fetal medicine screening for preeclampsia, discussed later on by Professor Nikolaidis? Well, a short preview. The algorithm for early screening for preeclampsia works. Uterine artery measurements may be difficult, it might be omitted, and still you may have an improved outcome. There's only one, but very promising randomized controlled trials. I have no idea how many are in progress, but has this already been implemented nationwide in any country? If I look at my own country, there seems to be a delay in implementation. And why? Is it jealousy because you didn't invent it, someone else? Is it ignorance? Or is it laziness? No intention to make a real effort. It's too complicated. Rather give Viagra than to doing this complicated prevention. So as far as early fetal medicine foundation screening for preeclampsia is involved, in my opinion, please discuss this within your own country, in this case Ukraine. Either do a randomized controlled trial, a clinical effective study, or implement it. There are no other options. It's one of the two options that you have to accept. This is a paper from Science now 13 years ago. Indisputed and important medical discoveries take on average 17 years. 17 years to reach clinical practice. Please, let's do it a little bit better this time. And now it's time to go to the next presentation. Thank you very much for your attention. I will stop sharing my screen and I will offer the floor